Hi, and welcome to another episode of Umwe Sit Downs. I'm your host, Brian Akambonde, and today I am joined by Dr. Ampim from the University of Bergen. Dr. Ampim, please welcome.
Thank you very much, Brian. It's nice to be with you this morning.
Thank you. The pleasure is always mine. Always great to have a new face join me with an even better idea to dissect and talk about. So Dr. Gloria Ampim wrote an interesting piece, right, on antenatal or prenatal care in Ghana, and more specifically the role of men and how sort of like they are involved and perceive and see their role throughout that process. And today we're going to talk about that study that she conducted in Ghana, but more so questions that I had, after reading through some of her findings. And so, Dr. Ampim, one of my first questions, or the first question I have for you rather, right, is what is the core reason for the lack of involvement of men in and sort of antenatal healthcare, or what exactly is causing sort of like the fundamental lack of involvement of men in the prenatal healthcare process?
Thank you for your question. And before I even answer the question, I just a little something small before I proceed. I am still in the process of becoming a doctor, so very soon, but it's not yet. So I am not Dr. Ampim.
Right, and my bad for for referring to you as doctor. We clarified that before the getting started, and somehow I guess I am jumping ahead of what of the whole situation. But soon enough, we are manifesting here. We're manifesting. All right, Ms. Ampim, no worries. Yeah, so let's just your thoughts on that question then.
Yes. So when we talk about male involvement, if I start from the bottom, it encompasses a lot of other things. It's not just about male participation in antenatal, delivery, and postnatal care. It's also about men's active role in both physical and emotional support to women during the time of pregnancy and also after. So it's about joint decision making. When are we going to seek healthcare? It's about how much of the household resources are we going to allocate to maternal, to the pregnancy, and it's about how are we going to share housework during this period, especially in situations maybe when you have an older child who is going to take more responsibility for that child during the period where you are when the woman is expecting a child. So looking at it from this variety issues or that's come together to make maternal health, you think about some of the issues, the reasons why men may not participate or men will be left out during this period and leave the woman alone. And the first is the social perceptions of the division of household labor. The perception that men are the head of the household, they are responsible for the financial care of the home, they provide the money, and then women are the ones who perform household chores, and women are the ones who give care to children. So this is one aspect of it. And this one, maybe for now, we should not call it patriarchy, but because I'll come down to patriarchy. Then we also think about knowledge, whether men in the first place are aware of what their role is, of what they can do to help the woman during this period. And then we also think about time. So these are some of the issues that come together to decide whether men will actively support their partners during pregnancy or not. And even for those who participate in the antenatal care, when they go there, what do they see as their role? What are they going there to do? So when you look at it from this broad, this range of issues, I think patriarchy is just a little aspect of it. Because if the man is making all the decisions alone, if the man decides that, okay, my role is to pay the bills, or my role is to provide food for the household, I have done that, so I am done. Then at that point, you can say patriarchy. So in that case, patriarchy is just like a little portion of the reason why men do not get involved. But the other social perceptions that this is not a man's role, that this perception is not just about our patriarchal society, but it's also about how things have been, how even women also think about men in the society. So even if maybe the man is not just aware that I can also do this to help, or maybe the man attempts to do this to help, and then the woman will be like, oh, this is not your role, leave it to me. Or maybe his mother, his mother's-in-law, his sisters-in-law, they'll say, oh, we the women are available to help your wife. You just focus on providing the household income. So in this case, this is the broad, the social cultural norms that structure our way of life more than just patriarchy. Of course, patriarchy is one of it, but I think patriarchy cannot be the sole, we can't put all the accusation on all the fault on patriarchy. And also about time, whether men have the time at all to be involved. And this also goes back to how we perceive the gender division of labor, because it's the man's duty to go and find food, to go and to bring the money. If he's focused on those activities, then it means that he will not be able to participate in, that he's not thinking of himself as participating in giving physical care or any form of support in the household. So patriarchy is part of it, but patriarchy is not entirely responsible. And even when patriarchy is responsible, it seems that we as women also play a role in shaping how men see their roles and responsibilities, whether we give them the space to do anything at all. Right. That sometimes that also depends on us as women. Yeah.
A natural follow-up question here is then, how does the education, or I guess the communication, then come in, or how can that be done to say that, okay, well, women in Ghana need to now understand that there's space for more involvement of men in the whole antenatal care and all the stages of care that they have to go through. So yeah, how do we educate both groups? I think, to kind of get to a stage where it's an easy process for everybody, and especially now, mother figures who tend to be overburdened, it seems, in this process.
Yes. So with when it comes to the education, maybe the sustainable one is from below, from how boys and men are brought up, even in the home, of how women think of how girls think of men from the beginning, of how boys think of themselves growing up, the kind of men that they want to be. So it's about changing the sociocultural norms from below, from when we start bringing up boys and girls from the home. But then also in the schools, when we are reading about girls and boys in our textbooks, what do we read about? Is it about, do we still have pictures of girls going to fetch water and boys playing football? What do we have in our textbook from below? But then, when we started from below, there is also the childbearing population that we have now, who also need to learn and who also need to be educated. And in some of the communities, we have fatherhood clubs, motherhood clubs that are kind of teaching some of these norms and some of this knowledge. So those are some of the things that we can do to bring women, gathering women and men together in separate groups, in one group, to effect some of these new norms of fatherhood, or more of this equal sharing of burden in both paid and unpaid labor in the household. And it is also interesting to note that in the African setting, a lot of women are involved in paid labor anyway. They also go out to work and bring home and also end up contributing to the household income. But when it comes to the doing housework, then it is still like it's the woman's responsibility, because our societies have been structured in a way that a woman is a woman only when she is able to perform, she's able to keep her home, when she's able to take care of her children. And setting these high standards in performing housework and childcare, even for women, is one of the problems, because then as women, we don't, even when you are working, when you are a farmer, you are a trader, you also contribute to the household, you still don't see it as enough. It's not enough for you. Don't see it as an accomplishment until you are able to take care of your home and take care of the children. So whilst we are talking about how men can support, it's also, we should also look at how women and girls view themselves as who is a good woman. Is a good woman the one who is able to take care of the home? Or is a good woman the one who is able to take care of children? Or is a good woman the one who is able to also provide the household income? And also making the conscious effort to acknowledge the value of women's economic contribution to the household. To start thinking about it, that if you also contribute to the household, that is also an achievement. And for that reason, it is okay for the man to also support, not just for that reason, but also it's his household as well, it's his home. So if he cooks for himself, there's nothing wrong with it. So starting from below and also targeting those who are already in the childbearing age, within the childbearing population. Yes.
Right. Wow. That's a very, I think, clear, and well kind of structured view on what it is that's kind of standing in the way of educating, changing perceptions to kind of have both the mother and father, the father more productively kind of involved in that process. Is there any difference in the labor experience between that of a woman with a partner present and that of a woman with their partner absent in the process? By partner, of course, that meaning the soon to be father.
Yes. So in the labor process, if I will start with the maybe let me start with the delivery experience. For using Ghana as an example, a lot of our government facilities don't have private rooms. Like you have 4-5 women have given birth or in labor at the same time. So it is impossible to bring men. They can't stay there physically. So in most of our government facilities, that's when the physical participation in labor and delivery is out. But then from the beginning, as we talked about male involvement encompassing a broad range of activities. What about if you are not there physically, what about the emotional and then the financial support as well? So of course, when a woman is in labor, there are a lot of things that are needed. If you look at the Ghanaian setting, for instance, you have to pack, her things must be ready, arranging for transportation. Even that has to be done ahead of time. When you get to the facility itself, sometimes you have to make decisions. Maybe we have to induce, maybe we have to do a cesarean, maybe we need this drug, we need that. The person who is in labor at that time will not be able to make those decisions. And the best is to have her partner, because they have to, that is why we talk about joint decision making. They should have talked about this ahead of time and planned towards what we would do at this time, so that the woman herself can focus on the labor and then the delivery process, whilst her husband is with her to make some of these decisions. If there is the need to buy some medication in case she does not have the health a health insurance, her husband will have to be there to support. Not just the husband, of course, she can have other relatives, but what is better than having the person who you are having the child with you through this process? So of course, that will give you some form of emotional comfort for that process. So with that alone, that is a good enough reason to say that women who have their partners beside them or support when they are in labor and delivery will have a better experience. And when you talk to the midwives from my study, for example, they tell you of how some of the men are involved. Sometimes some of them arrange of transportation ahead of time because they know maybe their workplace to the house is far. But when the woman is finally at the clinic, sometimes they keep calling. So even when they are not physically present, they are calling, they are on phone to make some of the decisions until they come to the facility. Now, in some sectors, like in the private hospitals, where they have private labor wards, there are also men who stay with their partners during the birth process. And I've heard a testimony of one man who said he was he kept massaging his wife with a warm towel throughout the process, and she said it gave her some form of comfort. So of course, having your partner with you during the labor and delivery will definitely give you a form of emotional support and good and better experience than someone who is alone. That is not the time you should be thinking of of what to do. So
right. Yeah, no, very well said, Ms. Ampim. And so, I think as I hear your response, it was interesting for you to kind of draw a distinction between the experience in a private versus now a public hospital, just by virtue of having a private, sort of like a private room, where you can stay, and that allowing for the father to more easily be physically involved. And so I'm very curious to see if there's more to be said, not necessarily between private versus public, but rather, in terms of how does then the healthcare system itself kind of either promote or demote the involvement of the father. What your thoughts are around that, because we did talk about the perception and view of the mother, and then the perception and view of the father, and how both genders kind of are culturally taught and brought up. But what about the healthcare system itself? Does it promote or demote the inclusion of the father in the entire sort of labor process?
That I would say that is a gray area. It's ambiguous because with the talking about Ghana, no one stops any man from being around his wife during labor or delivery. But depending on the facility that you are going to, and when you know your wife does not have access to a private labor ward, it means you are completely out. You can't go in there. But for your presence at the hospital while she's in labor and delivery is encouraged, is highly, highly encouraged in the government sector. And also they encourage it because of the decisions that have to be made, because they also know that when the man is there, the woman feels more comfortable. When you ask her something, she'll tell you, go and ask my husband. And it prevents a lot of delays in maternal health. So it is encouraged. But then for you to be present there, that is something that our health system cannot, especially the government health system, cannot take on at this time. The numbers are large, the facilities are limited. So things have to be done according to the resources that they have available. So if they don't have more space to have private wards, then they can't have the man there in any case. But then for his presence at the premises while the labor and delivery is going on, that is highly, highly encouraged. Yeah. During labor and delivery. And during labor and delivery is when most of the hospitals record the highest number of male involvement in any case. They are there. They want to. They also want to be part of the process to make the decision. Yes.
But so that brings me really to the end of my questions. But I'd like for you to say any final words, if you'd like, maybe final comment or point that you feel is important to stress, or any other thing that Ms. Ampim has to share with us.
Yes. So I think that for male involvement, of course, it starts from the home. What happens at the facility is a little part of it, but the joint decision making, the male participation in housework, the physical and the emotional support for the woman during the time until after birth. So I think a lot falls on us as individuals in our homes, but also a lot on our systems as well. The healthcare system is in Africa, in Ghana, for example, is most of the time overstretched and overburdened. So they can only do things within their capacity. So it's time for us to also encourage our health facilities to think, what are the very little things that you can do to involve men, even within the limited facilities that you have, and leave it to the administration of the facilities to design and discuss some of these things to include. So the health system, and then also from our homes. And also for us as young parents, I think now we have a lot of burden. How are we going to bring up our children? Because when we talk about women's empowerment, who are we empowering the woman for? Is it for the man who still thinks that he's the head of the household? So how are we bringing up our children, both boys and girls? So it starts from the home, and then the systems will also support the educational system, what they teach and what they read at school. And I think that starting this transforming gender norms from the bottom up will be a more sustainable way to achieve gender equality in the near future.
Right. Very, very well said, Ms. Ampim. And I really appreciate you joining us today to give your insight, and as well as, essentially engage us in a topic that is really interesting, right? One that I think many people probably think about in very shallow and random kind of sporadic spats, but I think people will appreciate, hearing this conversation where we sit down and really kind of try to understand very deeply these dynamics that occur during the labor process. And with that said, Ms. Ampim, thank you so much for your time once again. Really been a pleasure.
Thank you very much, Brian, for having me. It's always a pleasure for me to talk about male involvement and about gender equality in Ghana.